Sciatica is a common condition that affects many people at some point in their lives. It is a type of nerve pain that originates from the lower back and travels down the leg, following the path of the sciatic nerve. The sciatic nerve is the largest and thickest nerve in the body, and it branches off from 5 nerve roots in the spine. Sciatica can cause various symptoms such as burning, tingling, numbness, weakness, or electric shock-like sensations in the affected areas. The pain can range from mild to severe, and it can be worse when coughing, sneezing, or sitting for a long time. Sciatica usually affects only one side of the body, but it can sometimes affect both. What causes sciatica? Sciatica is caused by anything that puts pressure on or irritates the sciatic nerve or its roots. The most common cause is a herniated disc in the lower back, which is when a disc bulges out of its normal position and compresses a nerve root. Other possible causes include bone spurs. These are bony growths that form on the edges of the spinal bones, often due to aging or arthritis. Spinal stenosis. This is a narrowing of the spinal canal, which can reduce the space for the nerves to pass through. Spondylolisthesis. This is a condition where one vertebra slips forward over another, causing misalignment and instability of the spine. Piriformis syndrome. This is a condition where the piriformis muscle, which is located deep in the buttock, spasms or tightens and squeezes the sciatic nerve. Tumors. These are abnormal growths that can develop inside or outside the spine and press on the nerve. Infections. These are rare but serious causes of sciatica that can involve inflammation or abscesses in the spine or pelvis. Trauma. This can include injuries from accidents, falls, sports, or violence that damage the spine or nerve. Diabetes. This is a chronic condition that affects how the body uses sugar and can lead to nerve damage. How is sciatica diagnosed? To diagnose sciatica, your healthcare provider will ask you about your symptoms, medical history, and physical activities. They will also perform a physical exam to check your reflexes, muscle strength, sensation, and range of motion. They may also order some tests to confirm the diagnosis and identify the cause of your sciatica. These tests may include X-rays. These are images that show the bones of your spine and can reveal fractures, arthritis, or bone spurs. MRI. This is a scan that uses magnetic fields and radio waves to produce detailed images of your soft tissues, such as discs, nerves, and spinal cord. CT scan. This is a scan that uses X-rays and a computer to create cross-sectional images of your spine and can show herniated discs or spinal stenosis. EMG. This is a test that measures the electrical activity of your muscles and nerves and can detect nerve damage or compression. Nerve conduction studies. These are tests that measure how fast your nerves transmit signals and can identify which nerve is affected by sciatica. How is sciatica treated? The treatment for sciatica depends on the severity of your symptoms and the underlying cause of your condition. Most cases of sciatica brew with time and self-care measures such as resting. You should avoid activities that worsen your pain, such as lifting heavy objects, bending or twisting your spine. However, you should not stay in bed for too long, as this can make your muscles stiff and weak. You should try to resume your normal activities gradually as your pain improves. Applying heat or ice. You can use a heating pad or an ice pack on your lower back or buttock for 15 to 20 minutes several times a day to reduce inflammation and pain. You should wrap the heat or ice source in a towel to protect your skin from burns or frostbite. Taking over-the-counter pain relievers. You can take medications such as ibuprofen, naproxen, or acetaminophen to ease your discomfort. However, you should not take these drugs for more than 10 days without consulting your healthcare provider, as they can have side effects such as stomach ulcers, liver damage, or bleeding problems. Doing gentle exercises. You can do some stretches and exercises that target your lower back, hips, and legs to improve your flexibility, strength, and posture. These exercises can also help relieve pressure on your sciatic nerve and promote blood flow to the affected areas. You should consult your healthcare provider or a physical therapist before starting any exercise program, as some movements may worsen your condition. Before we continue, if you're enjoying this video, don't forget to hit that like button and subscribe to the channel. It really helps us and let us know what kind of content you want to see more of. If your sciatica does not improve with self-care measures or if you have severe or persistent symptoms, your healthcare provider may recommend other treatment options, such as prescription medications. Your healthcare provider may prescribe stronger pain relievers such as opioids or other drugs that can help with nerve pain, such as antidepressants or anti-seizure medications. These drugs can have side effects such as drowsiness, nausea, constipation, or addiction, so you should use them with caution and follow your healthcare provider's instructions. Corticosteroid injections. Your healthcare provider may inject a steroid medication into the area around your sciatic nerve or nerve root to reduce inflammation and pain. This treatment can provide temporary relief for up to a few months, but it can also have side effects such as weight gain, high blood pressure, infection, or nerve damage. Physical therapy. Your healthcare provider may refer you to a physical therapist who can teach you exercises and techniques to improve your posture, alignment, and movement. Physical therapy can also involve modalities such as massage, ultrasound, electrical stimulation, or traction to ease your pain and relax your muscles. Surgery. Your healthcare provider may recommend surgery if you have severe sciatica that does not respond to other treatments or if you have serious complications such as leg weakness, bowel or bladder problems, or loss of sensation. Surgery can involve removing part of the disc or bone that is pressing on the nerve or fusing two vertebrae together to stabilize the spine. Surgery can provide long-term relief for some people, but it also carries risks such as infection, bleeding, nerve damage, or failed back surgery syndrome. How can sciatica be prevented? You may not be able to prevent sciatica completely, but you can take some steps to reduce your risk of developing it or having it recur, such as maintaining a healthy weight. Being overweight can put extra stress on your spine and increase your chances of having a herniated disc or spinal stenosis. Exercising regularly. Staying active can keep your muscles strong and flexible and support your spine. You should do a combination of aerobic and strengthening exercises that target your core, back, and legs. You should also warm up before exercising and stretch after exercising to prevent injuries. Practicing good posture. You should avoid slouching or hunching when sitting, standing, or walking. You should also use proper techniques when lifting, carrying, or reaching for objects. You should keep your back straight and bend at your knees and hips, not at your waist. You should also avoid twisting your spine or holding one position for too long. Sleeping on a firm mattress. You should choose a mattress that supports your spine and keeps it in a neutral position. You should also use pillows that align your head and neck with your spine. You may find it helpful to sleep on your side with a pillow between your knees or on your back with a pillow under your knees. Modifying your work environment. You should make sure that your desk, chair, computer, and other equipment are ergonomically designed and adjusted to fit your height and preferences. You should also take frequent breaks to change positions and stretch your muscles. Managing chronic conditions. You should follow your healthcare provider's advice on how to control any medical conditions that can affect your nerves, such as diabetes, arthritis, or infections. Thanks for watching.